call to order the Community and Economic Development Committee. With me on the committee is Council Members Littlequist and Vargas. We have one item, resolution amending the 2012 Housing Levy Administrative and Financial Plan. Go ahead, David.
Thank you. David Stahlheim, Community Development Block Grant Manager. And this last summer, Mayor Kelly came to our staff and asked for what can we do a little bit more in terms of outreach to the homeless in our population and getting assistance for those that need it the most. And so I turned to the two experts in our community, Gail DeHogue, the Whatcom County Housing Specialist, and Greg Winter, the Director of the Homeless Service Center. Unfortunately, they had been working on a homeless outreach team proposal at the time, and so we were able to present something to the mayor and to the community. And so I'm going to turn it over to Greg to walk through this at the beginning of this. So, Greg? Okay. I'm sorry?
Thanks, everybody. David Director of the Homeless Service Center. There we go. That's better. Director of the Homeless Service Center at the Opportunity Council. And what we wanted to present to you today about the outreach team is driven largely by the many human tragedies that are comprised by the situation that we have with, on any given day, about 200 people living unsheltered in the community. It's a stubbornly persistent level of unsheltered homelessness that we've had with us for quite some time. Around the state, we've actually seen large increases in unsheltered homelessness. We haven't, in the wintertime when we do our homeless census, seen that kind of an increase here, but we are seeing it, we think, seasonally in the summertime. What we've been doing that I'm very proud of and impressed by is working collaboratively more than ever with city departments, police, public works, and the Parks Department in trying to come up with solutions together. And under Mayor Kelly's leadership with a recent Community Solutions Group, that process and working with these city departments has really helped us put together an outreach team proposal that I think has got great promise, not only to address the human suffering that we see on our streets, but also realize some other community goals like increased water quality in our streams, increased positive user experience of our trails and our parks, and reduced waste stream going to landfills, and reduced staff time actually addressing those, cleaning up those encampments that are out there. We have, I think we're going to show this video, which also helps drive home what it is that we're trying to do in collaboration with many organizations and different sectors, both public and private sectors, throughout our community. And I think this video speaks for itself. So why don't we just go ahead with it.
So one of the things we didn't do is test drive the sound part of this video. Here, this is the first time we've done video through this, so let me put that on pause. Apologize for that. Marie's checking to see if there's a way to
make myself a bed. It's like somebody will find me passed out somewhere, and then they call the cops.
It was Thursday night, and I'm coming down this way to get in one of the shelters. This car come up, stop the stop sign, what they're supposed to do. And one guy said, if you don't get off the street, I'm gonna kill you.
Life on the street is so tough. I mean, you get beat up or fall down. And one time I was stuck down there for 3 days at Whatcom Creek. So I'd crawl out of there, throw my cane up, crawl, throw my cane up. And I would take cardboard and plastic out of the dumpsters to make myself a bed. It's like somebody will find me passed out somewhere, and then they call the cops.
Post-traumatic stress disorder
That's a disabling condition. Okay.
and depression, stress, everything. I got the whole 9 yards.
Yeah. Okay. So last time I talked with you, we had some goals about housing was a big one.
That's a majority.
Yeah.
Housing.
And I'd say getting established with a doctor would be the second one.
Absolutely.
You can say 2. I felt that way more days than not in the last 2 weeks. And 3, I felt that way every day. Feeling tired or having little energy.
3.
Poor appetite or overeating.
3.
Feeling bad about yourself or that you are a failure, that you let yourself down.
3.
Okay. Trouble.
There are a small number of individuals who are living enormously complicated and oftentimes chaotic lives. And in living those chaotic lives, they are oftentimes consuming enormous amounts of resources.
We spend half of all of our money in healthcare, half of those trillions and trillions of dollars. Half of all of that goes to 5% of the United States population. And 25% of all of it goes to 1% of the United States population.
We are working closely with the Whatcom Alliance for Healthcare Advancement, which is a local entity here that has really brought the healthcare community together to rethink how we provide healthcare services here in Whatcom County. And they've been remarkable leaders in that. Intensive case management is an effort to really reach people where they are and to help them achieve constructive ways of managing the challenges that go on in their life.
For many, many years, on a national scale, we've known that intensive case management is an absolutely critical tool to help keep healthcare costs down and give people the support that they need, particularly very complex people with complex medical, behavioral, social issues.
There's strong evidence that housing is really important, and that if people are homeless and we house them, you then create opportunities to work on the other issues that people confront in their lives. But that housing is enormously important.
All I get to know.
And,
I'm sorry, we
you know,
can't help you.
Yeah.
We can't help you.
You've heard that a lot.
I've heard it a lot. Ever since I put come out of the military.
Yeah.
I don't know why. I don't know. I don't think I'm such a bad guy. Sometimes I lose my temper. But that's because of the situation I'm in. Again, it's my environment. I got to get myself out of this environment.
There is this myth in America that's still there that we should all be able to pull ourselves up by our bootstraps. That means you have boots that have straps. And that means that your fingers work and that you have enough strength and you've had enough to eat and you feel safe to put on the boots. So there's a lot of assumptions in there.
Good morning. Hi. Hi. How are you doing? Good. It's good to see you.
Do you remember your doctor's name?
No, I don't even know. That's a new doctor.
What we're seeing now is when people are given housing first, like in a housing first model like we operate in, bring the housing first, that lots of different areas are improved by having that stability, and that includes medical care, mental health care, and chemical dependency. People have started drinking less just by having housing. So the old notion that we need to be clean and sober and lace everything up all tight before you get there, we've dispensed this. And there's actually research now that shows that really what makes the most sense, meeting people where they're at, having the housing come in first, and then begin working on those services.
A checkup and just medication, checking in on medication.
Sure, that'd be fine, yeah.
Yeah?
12. Yeah, because I need
Go
my...
after lunch or something?
Yeah, it's good, yeah.
Okay.
12.
Yeah, let's do 12:15.
We have people who have been living on the streets for a long time with very serious chronic medical issues, but haven't been getting medical attention. So a lot of times There's the good about getting the apartment and getting off and getting up the streets and having your own place. But as they start getting connected to providers, we've had some folks kind of have untreated diabetes, for example, that they've had for some time.
In America, we spend extraordinary amounts of money on two things. One is healthcare, and another is incarcerating people. If people have mental health issues that aren't being attended to, or if they have substance abuse issues, or if they are homeless and their lives are complicated by healthcare issues, they're likely to end up in the hospital, or they're likely in some way to transcend what society thinks is appropriate behavior and end up in jail.
Oh, absolutely. Jails are not recognized as such, but we're pretty much the last stop social service agency for a lot of people in this community.
We really are primary care providers. So they don't have the ability or the know-how or the access to general medical care. But they know that when they call 911, someone who's trained is going to come help them in one way or another.
Sometimes I think that police officers will bring people to jail because they don't know what else to do with them. That the other social services either cannot or will not address whatever the problems are, and part of it is because sometimes you can't tell. This is, again, that very small population of the homeless, but they oftentimes are what's called co-occurring disorders, so they've got mental health and chemical dependency problems, and trying to straighten that out, oftentimes you need them in a place that's safe and secure, let the alcohol and drugs come out of their system, and then sort out what the resulting deficits may or may not be.
Emergency care is the most expensive health care that you can possibly get. The concept, of course, is we see people, all people, regardless of reason they're here. We're obligated by EMTALA mandates, federal mandates, to see and evaluate everyone.
Not only is it harder for them to get access because how they're living, but their coping mechanisms are not in place.
So right now they come into the general population emergency department. When you walk in the door, everybody's the same. We do the same triage process, we go through a medical evaluation, and then we have a specialized emergency care unit that once we've identified what the principal issues are, for instance, behavioral health, substance abuse.
I find mental health issues to be, I don't know if overwhelming is the right word, but extremely prevalent in the homeless population. And it exacerbates all of their issues.
Homelessness, mental health, substance abuse, because that's the trifecta right there. And if you have one, it's highly likely it's going to lead to another.
But there's a recognition in this community that the jail and law enforcement comes across these same folks. That if you come up with a list and you show it to the people at the emergency room, and you show it to the jail, and you show it to the law enforcement folks here locally, we all know the same people.
If you have clients who come in 10 times a month, you can just imagine what that's going to cost. Well, let's just say we see our frequent flyers. And sometimes those things, whereas it's easy to sit here and explain them and categorize them, they're not so simple in their mind, and sometimes even for us to kind of filter out and figure out what the real issue is challenging. Just listening. Sometimes that's all that they need. It's still oftentimes very hard to get at what the real issues are, what really happened. Sometimes they don't ever want to talk about it.
I've done a lot of changes, hard work.
To hear Cindy today, because when she first came into my office, her life was in such chaos.
I've lost about 100 pounds, keeping it off. I also have become clean and sober.
She was always crying or really upset or just all over the room, basically. And just her diabetes was way out of control. And it just seemed like everything was a huge effort for her.
I was homeless, and between the program through Interfaith and the program through Lydia Place, I have acquired my own apartment.
Living in her own place after being homeless, having control of her diabetes, losing all that weight. I mean, that is just tremendous.
And then I was in a tent, and I had planned out my suicide. And the day that I had planned it, the Lydia Place called with a room, and I call them my saving grace. If it wasn't for them, I don't think I would be here today.
You know, one of the big problems with homelessness is if you don't have a place to go, to be able to be organized and together, it makes it really hard to follow up with care, to be able to access all of the amazing resources that we have in this community.
Now that I got the housing situation under control, everything's just going great. A year ago, I couldn't say I love my life, but right now I do. I love my life right now. And I work damn hard to get here.
Mm-hmm. That's why I work here. I love seeing people go from where Cindy was to where she is now and really loving her life, as she said. That's worth it all.
So in order to have the biggest change, you have to go to who and where the costs are. And if it's that 1%, that's where we have to go. What's the financial incentive for helping people who are homeless have better access to care? There's no doubt that people who are homeless suffer disproportionately from behavioral health illness. They're more likely to die within just a few years of being homeless. And the deterioration of the quality of life happens very, very fast.
But if we can prevent the need for hospitalization, we've saved money. And primary care is a more cost-effective way. Focusing on prevention is a more cost-effective way. Focusing on the treatment of chronic diseases in the outpatient setting is a far more cost-effective way than failing to do that and ending up either in the hospital or in jail or in prison. So yes, primary care services are expensive, but they're a whole lot less expensive than the alternative.
There's lots of multidisciplinary intensive case management happening, but we take it to an entirely new level. We are focusing on precise needs of the people we're talking about. Crossing into the criminal justice system, crossing into housing, crossing into emergency medicine, the paramedic system. We don't want to change the person. They are the way they are for a whole history of reasons. So we need to stop talking about what they need to do differently and talk about what do we need to do differently. How can we adjust? So instead of saying, oh, the patient failed to comply, we need to say, what can we do differently? And intensive case management is that aha solution.
My name is Gail DeHogue. I work for Whatcom County Health Department, housing specialist, and what you have before you is an outreach housing proposal. We call it the HOT team, Housing Outreach Team. And I think one thing I want to share with you, it's okay, Frederick Charlie, the last person you saw in the film, was someone who finally made it into housing after years of attempted engagement and outreach. He's no longer living, but he died in housing, and he died sober. And I think it's a real testimony to how outreach can work and how a system that sticks with its residents, no matter who they are, can actually get people into housing. But what we have learned, and what has been said earlier, is we, the housing system, have been trying to put together an outreach team for a few years now. And recent events, actions, activities, many under the leadership of Mayor Kelly, and then working directly with City of Bellingham staff, it became glaringly apparent we were missing a crucial component of our housing system. and it was the outreach component. It was the street level component, street level action that can help our housing system engage with those who are living on the streets, those who are costing us more public dollars than we need to invest if we were just investing in housing, for example. We need an outreach system to connect with those people, earn their trust, and then connect them to the systems that will help them get off the streets. We need to help them get off the streets. And we also believe that our outreach system can offer a piece that we call a second response, or the second responders. Instead of the police department, instead of emergency department or the emergency response system responding to homelessness, we think that we could have an almost 24/7 presence, maybe 18-hour-a-day presence for those first responders to turn to help respond to our homeless individuals on the streets with some behavioral issues that we think can be addressed more appropriately from the social service system in concert with the police department. So that's basically our outreach component that, with this proposal, though, is coupled with units of housing in a different look than bricks and mortar. Units of housing which mean vouchers to pay for people to pay monthly rent, or subsidies to help pay for those who don't need long-term rent, but maybe some rent just to get in a few months' worth of rent.
Okay, and so how the request to the City Council is an amendment of our housing levy administrative and financial plan, and we have $306,625,000 as an annual city cost, of which more than half of that would be in new housing vouchers. The funding sources proposed are $250,000 per year out of the 2012 housing levy. The balance would come out of federal funds, our home investment partnership funds. And part of this proposal includes over $127,000 of matching funds. So the actual levy amendment is transferring $250,000 per year from the Production of Homes program to the Rental Assistance and Supportive Services Fund. This action would leave an uncommitted balance of over $8.5 million through the life of the levy in the Production of Homes program. Just kind of talking about the levy goals, we had sent out our annual performance plan recently, and this is a highlight. We are doing extremely well for only 2 years into the housing levy. The production and preservation program set a 7-year goal of 417 units. We already have commitments of 347 units through 2 years of this program, 2 years out of a 7-year program. In the Rental Assistance and Supportive Services program, our 7-year goal was to serve 1,098 households. We've already served, after 2 years, 1,612 households. So we're doing extremely well in that category as well. We go back to the uncommitted balance of $8.5 million, and you have more details in your packet. But we've been averaging a little over $21,000 per housing unit in the production program. If we actually even increased our level of investment up to $30,000 per unit, we'd end up being able to produce another 283 units of housing in the community over the life of the levy. And again, our goal is only another 70 units, and so we're going to easily surpass any of the expectations that we had in the levy going into this program. So with that, if there's any questions for myself or for Greg and Gail, we'd be glad to answer them.
Okay. Thank you, Dave. Committee. Go ahead, Bing.
Can you define for me, David, what it means that has made a commitment of 347 units? Does that mean that we've already found those units, or that we're putting money towards those units? What does that mean?
It means that we have awarded contracts to agencies to do that. So they're not on the ground yet, but they're contractual commitments to get there. So usually when we fund things, if it's a production project, it could take 2 years for it to actually be on the ground. So that's our commitments.
Michael?
Let me start by saying I'm fully in support of funding the homeless outreach team, but I do have questions about particulars and how it affects the housing levy. Let me start with a smaller question first. CDAB recommended limiting the contractual commitment to 18 months. a trial period, but it looks like what we're approving is a permanent $250 shift, and $250,000 shift per year. We're not approving 18 months worth. We're approving, according to the documents, it extends to the last remaining years through 2019. So that's not an 18-month period. You're asking us to approve 5 years.
Yeah, we are. But we are only going to enter into a commitment for 18 months. We're going to evaluate this after 1 year's period of time. So approximately about January, February of 2016, we'll go back and look at how the program is going and whether to continue that commitment at that point. One of the things that, as we entered into the levy, one of the things that Gail DeHoog and I particularly had concerns about is that we really feel that the levy did not put enough funds into the rental assistance and supportive services side of this. And we're continuing to see that, and we anticipate that the need is going to be there for this program, for other programs in this side of the levy and the housing needs within our community. And it doesn't diminish at all the ability to produce housing. Again, we're going to have $8.5 million worth of funding left in this fund at the end of that period. In all the conversations with the housing developers, that there's no indication that that is going to be short during the time period of the housing levy.
I'll come back to that, but let's go back to my question, which had to do with 18 months. Why did CDAB suggests 18 months? I have no doubt the program is going to succeed. In 18 months, we will have reached, dozens, hundreds of people, and it will be able to show good results. Again, I don't have questioned the homeless outreach team. I'm questioning the funding, and in particular, why did CDAB recommend only 18 months to begin with?
Well, it was a long conversation that Community Development Advisory Board had regarding this, and part of it is that most of all the other projects came in at a given point of time during the year, and they wanted to look at the success of the program, whether to continue it or not, and they will get that opportunity to continue to do that. And basically January, February of 2016, we will do that process and evaluate it. And if it doesn't look like it's going to be successful, then we will not appropriate additional dollars for that and move the dollars into other programs as needed.
Well, again, I don't doubt the program will succeed. That's not my question. One of the things that you show is that we're meeting our production and preservation targets. Production and preservation are quite different. One, it's kind of hard to say it simply, but, to preserve a home isn't creating new housing stock, whereas production really creates new housing stock. If we're providing vouchers, we don't actually create affordable housing. We change the user. We change the person who's living in that house from someone who was homeless and is now housed, but there's somebody else who's not living in that house. So putting together production and preservation, I think, lumps together two entirely different goals. And one of the original goals of the housing levy, the way it was sold to the public, is we're going to make new housing at the low end of the affordability market. Now all we're doing is just creating more competition down at the low end of the affordability market. And so I'm concerned about shifting away from production. Again, I'm not against the homeless outreach team. I'm worried about not doing as much production. If you're saying we're still going to do lots of production, we could do more. $1.25 million could do 40 new production units at $30,000 apiece. That's substantial.
Before we go too far, we're getting behind, so go ahead, Kelly.
No, I just, and I understand what Michael's saying. When you pass initiatives, and that's why you have these two people and David here presenting this information to you, many times at the state level, after 2 years, you look at what happened in the implementation and you make recommendations on potentially changing it. That isn't necessarily the way we do it in the city. We tend to pass something and kind of leave it. But my concern is we have a lot of goals. This is one of them. And what David and Greg and Gail and others have found when we did our public health and safety was good information that demonstrates this works, belief that we need to do it consistently and predictably because people are going to start depending on these programs. And I think we're going to find after 18 years we could even do more. Not take away from production, but understand that there's a lot of different ways to produce units.
Well, we are taking away from production.
Well, I think the point to me is, how do we ensure we have enough units available for the people that Gail and Greg would like to place? And at this particular point in time, we don't have requests for building more. I think you guys met the goals of what people were coming forward with building, but there may be other ways to make sure that there's units available. So all I'd say is we have a problem in that the jail and the hospital are not the place to deal with the people in our community when we have the resources to give them something that is more effective than what we have. So I would ask and recommend for the council that you look at the opportunity we have to review this in 18 months. And I think these two people sitting to my left would be the first people to tell you, don't continue this program, it doesn't work. Let's put more money
again,
back
Kelly,
into.
I expect it to succeed. What we will show in 18 months is that the homeless outreach team has succeeded. What we won't show in 18 months is what hasn't happened because there wasn't money for production that we could have been thinking about
I think
deploying.
you're missing the point, Michael. There is money for production. We didn't have requests.
And the next call for projects is going to have $3.2 million available for production. So I will be dancing a little jig if we get requests from developers to do $3.2 million of housing projects. And I anticipate, and we're helping to facilitate that process to get those people to come in for projects. But again, a little bit on the homeless outreach team. I mean, if people go out and reach out to the homeless, but we don't have housing to provide them, and we don't have housing to provide them, that's what this will do, is it's going to give housing vouchers for people to go to. We are maxed out on housing vouchers. We are at capacity, and we don't have any new units coming online that we can put people in. This will give immediate assistance, so when people start reaching out in January, we'll have housing vouchers and places to put people in immediately to address that need.
Again, putting people in housing with vouchers is fine, but it doesn't create more housing. When this levy went out, we were planning on spending 75% of the money towards production. Now it was shaved once, it'll be shaved again down to 65%. If it seems to me that I support the idea of increasing the outreach and the vouchers. That $250,000 a year sounds like a very fine use of public dollars. But we're shortchanging something which is a long-term structural problem. We have very low vacancy, and changing the category of person who's in a low-end housing doesn't actually address the structural problem, which is there aren't enough units in existence. And the reason why I supported the levy in particular is it was looking long-term towards creating new housing stock, not just changing who lives in existing housing stock. To me, this is not about whether or not HOT is a good idea. It's about how we're funding it. And I'm worried that we're robbing Peter to pay Paul, and I still want to support Peter. That's my policy concern with how this is being funded, which is not a concern with the HOT proposal itself.
And let me just clarify very clearly. When we did our chat, which Greg was on, when we did our chat Community Solutions Work Group, we were looking at how to gain more affordable housing and more units that weren't subsidized out of the housing fund. So we could use the housing fund for the people for whom it was intended. So there's not just one solution that we have going on in the city that's going to increase units. What we have is a multiple approach. And I have to tell you, I really appreciate the social service providers, the police, the legal, everybody who cooperated in this, pulling all the services together. And this recommendation, Michael, came out of a lot of months of discussions and prioritization, and the fact that we didn't have units to build this year. Shall we keep people on the street because we didn't have the units to build? And I think to a person, those of us that are sitting up here said no, we shouldn't. So it's using our money in the very best way and not reducing our capacity to get more units in our city.
Yeah,
After
and I just,
2 years,
if I
you're
might
looking-
really quickly, Gene.
We got 2 more minutes, then we're going to move on. Go ahead, Greg.
Just real quickly, and Michael, I know you and I disagree on this, but this really does create new units. The focus of that, as an architect, one of the architects of the housing levy program, I'd just like to say that the focus of the program is on helping people who are considered very low income with affordable housing opportunities. And the use of vouchers in this proposal actually does create new units of affordable housing for very low-income households by converting private sector rental housing that is currently not affordable to them so that it is affordable to them. So that's the rationale.
There's somebody else who would have been living there, and now you've changed the occupant. I would say that if the production component hasn't always seemed like an attractive opportunity to developers, if we don't get in enough proposals, I would hope for an equally thorough review of why that component or how that component might be approved so that more people take advantage of it. At the end of the, I don't know why it's not being taken advantage of, but I'd like that component to be just as, even more successful than it already is.
It's kind of a catch-22. One of the reasons that people aren't doing homeless housing is that they don't have enough rental assistance and supportive service funds to pay for it. They can build it, but they can't operate it. So we need a lot more rental assistance and supportive service funds to make these very, very low-income projects work.
Okay, Pinky, in front of us is the resolution, so.
I've been pretty concerned about the displacement that we're causing with the Aloha and cleaning up the embankment. And I got to say, this homeless outreach team, this gives me a lot of hope. I'm a strong proponent for Housing First as a model, and I think that is the way that we move people forward. I know it works. I am very supportive of this, and thank you for bringing it forward.
Yes, go ahead.
If we really want to get serious about this, let's take the last slide into heart. Because I mean it. I am tired of rhetoric about this. If we really want to improve this overall, then let's create percentages of new development that have to go to affordable housing. That's one example of something we can do as a policy group to really get the kinds of units that we need. And we will work with our people who know the best, who will tell us when we're at that dire need. We can do so many different things to support these populations that we need to work directly for. And so that's why I am so supportive of this.
Do I have a motion from the committee?
I'd like to move that we accept the proposal from the Planning and Community Development towards the homeless outreach team.
Okay, the motion has been made. Any further discussion? No. All those in favor will say aye. Aye. All those opposed? Okay, we'll bring that forward tonight.